Good afternoon. What is your County Executive Ed Day, and I want to thank you for joining me on the latest County Executives Update. First, we address the obvious news of the day, the flooding, the mess, the destruction caused by the remnants of Hurricane Ida. We've had widespread reports of damage with the major issues still remaining being washed out roads, culvert damage, and mud, rocks, and debris on our roadways. We have thankfully not had any serious injuries or deaths here in Rockland, and for that we're extremely fortunate. You may have heard in Westchester County there was at least one fatality, and they really got hit very, very hard, much harder than we did. We're also very lucky to have the incredible volunteer fire departments, our police departments, and emergency services agencies. Their response prevented significant loss of life last night, and I want to commend them publicly for their work and for their heroism. I also did thank the New York State Division of Homeland Security and Emergency Services, the direction of Governor Hochul. They pre-positioned water rescue assets in the Hudson Valley and relocated them to Rockland County's Fire Training Center in Pomona upon our request. And I want to let everybody know that the governor did give me a call this afternoon to check and see how things were going. It was a refreshing phone call, frankly. So we told her that we're getting through this. We have our challenges, but we'll be fine. And if there's anything that we need, we will certainly reach back. And the same goes from our end here. Anything that they need up in Albany to get information back, we will certainly supply. The DHSCS Water Rescue Team was deployed to Orangeburg, where they assisted Orangeburg Fire Department in rescuing 11 individuals from the floodwaters at the intersection of Route 303 and Orangeburg Road. They were redeployed to Westchester County after conditions here improved, along with a second water rescue team that we had requested around midnight. Several of the fire and police departments were involved in rescuing 74 people from vehicles submerged in floodwaters in the following locations. New City had 1 person, Tapan had 3, Nanuet had 10 rescued, Tallman had 25 people rescued, and Spring Valley had 35 people rescued. There were 212 total fire calls from 5:30 p.m. yesterday, that was September 1st, until 7 a.m. this morning, September 2nd. These calls could have been rescues, pump-out requests, alarms, or flooding concerns, among other issues. We are currently checking on any continuing risk from our area rivers and streams, and we have a helicopter performing an aerial assessment. I want to offer this thought. I was out last night looking at the circumstances and the conditions out here in Rockland County. I've made it pretty much well around the county. I have not seen anything as bad as this since Hurricane Floyd back in 1999. I remember coming back from a 4 to 12 shift with the NYPD and trying to navigate my way back to my home in New City at that time. Very difficult. It was very similar. I saw one house with water breach the house in the rear, was coming out the front door and pushed 3 cars up onto a sidewalk back then. We saw similar damage predominantly in Westchester County, but this is the kind of power these waters had. And the first flood emergency that anybody recollects was called last night. We pled for people to stay home. We did not want them to go out. All I will offer now is this. We don't overreact to these things. When we call out to people and we ask them to stay home and we ask them not to go out in certain situations, to be aware of rising waters, we do so because we know how bad it can get. And we're just looking out for you right now, and also the people who have to come out to rescue you. So again, things have calmed down a bit now, but again, when you get these warnings, I would ask you, please pay heed to them. They're given to you for your own safety and protection, and they're given to you because it's a necessary thing for you to hear.
I'll chime in there quickly. I know they can be annoying if they come across your cell phone at 4 in the morning and you're woken up multiple times within a half hour. It can be a little rough. That's being done for your safety. No one enjoys being woken up like that in the middle of the night to an emergency, but it is really very important that these things come across, that they get out there, and that you take them seriously when they do.
And John is also aware of the fact that I got a few of those phone calls in the middle of the night myself. So, by the way, this is John Lyon, my communications director, who's manning the Facebook laptop, I guess it is, pod, whatever it is. Okay. Anyway, we're in regular communication with the towns, our villages, our emergency service agencies, and Orange and Rockland. The other major issue that we saw locally was a derailment of a CSX train in Orangetown. 4 cars derailed due to presumed water damage and erosion of a track, but thankfully no leaks or other damage occurred. And I do want to understand, people understand, we regularly train and practice for exactly these eventualities. Our emergency service personnel were right on top of this as soon as they became aware of it. CSX representatives are on scene right now, and they expect crane and repair crews to arrive shortly. We believe they're there already. The response was delayed by flooding elsewhere and difficulty getting into Rockland County. We're making progress on the power outage front right now. We've reached a height of about 1,200 during the storm, and that is now dropped to, we've gone, actually, I'm sorry, we had 7,400 outages in Rockland County. It is now 580. I'm just double checking these numbers. Excuse me. That's 92% of the outages have been restored already. The goal from ONR, I was on a phone with the CEO of ONR this afternoon, is to get to 95% of the 95% restorations by 11 p.m. this evening, and all the restorations done by 7 o'clock in the morning. So again, that's where we stand with ONR right now. Our office already has heard from many of you asking in regards to FEMA, disaster assistance, and disaster loans. There are a couple of benchmarks you need to meet to qualify. I want everybody to understand this, makes it a little bit easier. The county as a whole must meet minimum threshold damages of $1,212,542 in losses and in damages. We're working with the towns and villages to compile this information now, and we expect FEMA and New York State inspectors to visit Rockland next week for an assessment. This is all protocol and routine. However, I want to be very clear that, excuse me, I want to be very clear that this is a long process. It does take time with FEMA. If your home or business has been damaged and you are not covered under existing insurance, you are likely going to have to pay upfront for any repairs or work that is done, and with a hope that you get reimbursed. Best thing you can do is document the damage with photos, save your bills, invoices, and receipts, because you could be eligible for a low-interest small business administration loan after the fact. For homeowners, this loan can be used to pay for a permanent repair and replacement of uninsured disaster damages. For homeowners and renters, it can be used to pay for the replacement of personal belongings. And for businesses and nonprofits, it could be used to repair or replace uninsured damages and inventory. So those are the things that can be addressed by FEMA support. We'll be making public updates throughout this process so residents are aware, and my office will have the latest information if you call to check. Now, a regular update on our COVID-19 numbers. Rockland County is doing quite well. Rockland right now is 74.3% of Rockland's 18-plus eligible population have received at least one vaccine dose. That is a 3% increase from 3 weeks ago. 70.9%, nearly 71% of Rockland's 12-plus eligible population, 12 years and older, have received at least one vaccine dose. Also, that is up from 3 weeks ago. Now, keep in mind the age of 12 cohort has only been eligible since May, and those numbers are very high, obviously. The percent of the population 65 years of age or over, one dose, they're up to 88% vaccination rate. So the numbers are good as it relates to vaccinations. What I can tell you, of those people who have gotten the one shot, you really do need a second one. Obviously, you made a commitment to get vaccinated. I'm asking you, please come back and complete your series, get that second shot, because that will give you a much stronger efficacy of the vaccine. As of Tuesday this week, we have 663 active cases of COVID-19. Active cases are confirmed positive results from within the last 2 weeks. So it's basically the first in that group are the first ones out of that group. It's like a rolling average. They have been reported to Rockland County's Health Department by local test sites, medical practices, and doctors' offices and hospitals. Now, to be completely clear with all of you, we do not know how severe our 663 active cases are. Many or most of them could be completely asymptomatic. So you could be basically carrying the virus and not know it. This is why you really should get tested if you feel there's something going on. What we do know, and I thank our local hospitals, Nyack and Good Samaritan, for the information they've been giving us, is that as of this morning, there are 19 people hospitalized and confirmed to have COVID-19 here in Rockland County. I'll offer two things. To put this into perspective, we may not know about how many people are sick. We just know they're testing positive. But we do know severity increases to a point where they're hospitalized. We can measure that number much more accurately. But put it in perspective, the number you're hearing, 19 people, is 3% of the people who tested positively. So I just want everybody to understand, when you hear a number of positive cases, it does not mean all those people are in a hospital, or even if all those people are sick. It just means they have a positive workup on a test. And as far as the number in the hospital right now, you remember the days early on, the first go-around with COVID, we had 350 plus in the hospitals. And the hospitalization issue is extremely important, whether we're speaking about the numbers directly of COVID, or whether we're talking about from a community perspective, if we want people not to get COVID, obviously, because if many people get sick and they put a run in the hospital, that affects the entire structure of our medical protection, and that is a dangerous, dangerous issue. You have a situation where if our hospitals are that stressed, you and your family could be in a car accident and not be able to get a bed in the hospital. These are the type of things that we have to be very, very concerned about. The other point, which again we have been honest and open about this, because we have all been told about the efficacy of the vaccines, and people were very strong in telling us how important it was to get vaccinated. And frankly, I still do believe that. But that put aside for a moment, there was a belief that once we got that shot, we were done. The fact of the matter is there should have been much more consideration given to the possibilities that the efficacy level may not stay as high, and we may have people who need to get a booster shot, for example. And that's something that we're going to speak of, because I believe that you need to be dealt with honestly and get the information and the facts that you need to make good decisions. Right now in the hospital, we have 9 who are vaccinated who are in the hospital and 10 who are unvaccinated in the hospital. So that's almost 50-50, about 45%. The range we've been seeing here so far is ranging from 20% to the low end to, this is probably one of the highest, John, I think, 45% that we've had so far. And we're going to keep reporting that information to you, because we want you to understand the dynamics of this vaccine. The vaccine seemingly does work. To the extent it does work, that's a whole issue we're working through. And I'm going to get into that a little bit later on. I don't want to repeat myself later.
Yeah, and one of the common questions we're seeing around this data, we're seeing it on social media, we're getting calls from people. If I'm vaccinated, if these people are vaccinated, why are they still getting sick? Right. Why are they still going to the hospital?
And again, this is exactly the reason why. It's because we were all told, essentially, you get the shot, you're finished. That's how we all figured it would be fine. It's not working out that way. Okay, it's not something that's a conspiracy. It's a fact that I think a lot of our leaders were just a little bit too optimistic about what they were saying. Some of our officials, non-political officials, again, the same. And we all look forward to the day we could take that darn mask off and after we got our shot. It didn't work out that way. So that's where we are. Now, we can dwell on it, or we can try to learn from it, and that's what we're trying to do. The vaccine is not 100% effective at preventing illness. If you develop symptoms, it's important to get tested, to stay home, and to monitor your symptoms. And again, to emphasize, that is not untypical for a vaccine for a respiratory virus. That's very important for everybody to understand. There are a small percentage of the population that still may become ill despite having been fully vaccinated for reasons such as age or underlying medical conditions, being immunocompromised, or whether a specific variant caused the infection. So when we go back to that 9 and 10 number, some of those people who are vaccinated, that 9 number, could be people who have comorbidity. They have other issues that could contribute going to the hospital when they get sick with any kind of virus.
And to chime in here, As great as these vaccines are reported to be, no vaccine is a silver bullet.
Exactly.
No vaccine is 100% effective. Vaccines that we have had for years, for decades, are still in the 90 to 95% effective range at their best. So when enough people are getting sick, someone's going to fall into that 4, 5, 6, 7, whatever percent, and they may get sick, they may get hospitalized. So but in the end, in the long run, you want to be in that 95% who's less likely to get sick. That's why I got vaccinated. That's why I know the county executive got vaccinated.
I'm older too. So.
And that's why we're talking about this with you, because it's important.
Yeah, Rocklanders also remember the measles epidemic we had here, and the efficacy of the MMR vaccine is shown to be, again, over years. The vaccine's been around a long time, 97%. And somebody drew a parallel, John, the other day about what can happen when the COVID virus comes at you, and if you're vaccinated, because people ask the other question about how can people who are vaccinated, how can they spread the disease, the virus. And the comparison that was made by somebody actually called into the local radio station, WRCR, was very good. She said that, this is not what happens when somebody sneezes and those microbes come at you, okay, and you're vaccinated. It doesn't bounce off you and fall to the ground. It actually will get into your system. So this is where the logic is that, yes, if you do have, you are vaccinated and you do get the bug in you, it may not be there for a long time. It'll protect you from getting sick or even testing positive, possibly, or likely. But you still have the ability to transmit that out to someone. So I thought that picture with the image was kind of interesting, actually. These are the questions that we talk about, because we're taking a very close look at what's happening locally, not what you're hearing in national news and talk shows. And we want to continue to navigate the situation with the information we see here locally at hand. So to that end, we are now receiving additional hospitalization data, including whether a person is hospitalized as symptomatic or asymptomatic, the ages of people hospitalized and their vaccination status, and if any of those hospitalized for COVID are in the ICU. Rockland County is the first county in the state of New York that has been putting this type of transparent information on our website. No other county had done that, and if they have, they're following us, which I like being in the lead. But Rockland County is the first to do this, and this is at my direction. I want you to have all the information we can offer based upon what we are seeing here, based upon information we're getting from our local medical professionals in particular. Right now, it's generally accepted by our health professionals on the front line that those who contract COVID have a much worse time of it. That's putting it in simple language if you're unvaccinated. We are seeing vaccinated individuals experience milder symptoms and shorter downtime, shorter sick time. And with the current Delta variant, that hits people much harder than the original COVID-19 virus. These are three observations we can share with you that are as true as we can see them to be. And again, they're offered not to be preachy, they're offered to afford information, so we're all on the same page here. This is what we're trying to do here out of county government. We're in the process of adding these additional data sheets to our dashboard hub page, which is accessible via rocklandgov.com, rocklandgov.com, our county Rockland website. Excuse me. I do not have an exact timeline when this update will be finalized, but I do expect it will be soon. All right?
To chime in there, if it's not tomorrow, it will be early next week, probably Tuesday next week, given that we're off on Monday.
So you're taking a day off Monday?
It is Labor Day.
Oh, okay.
Our unions,
we're going to get to that. Yep.
Our unions have fought hard to secure us the time off.
Okay. All right, so you heard it from him. John will make sure that gets done by Tuesday after he gets back from his Labor Day weekend. Look, well, I wish that no one was hospitalized by this disease. This number is well within the ability of our hospitals to handle. And again, as I mentioned earlier, it is critically important that we maintain the structure of our hospital system. If that fails, we have some serious issues well above and beyond COVID-19. We'll continue to monitor the health and safety of our workforce also. This is what we'll get into. Businesses that should be doing the same thing. We're working to ensure that we have correct PPE, or protective equipment, stockpile for our employees and first responders so we can respond safely to anything and everything that could happen. When it comes to our buildings and our staff, we have not considered any additional rules or mandates because the cases and numbers we're seeing simply do not call for it. We're not going to react out of a perceived panic or some kind of anxiety. We're going to act upon well thought out approaches that make common sense and to make good sense here in Rockland County. I continue to urge our residents, however, to take common sense protective actions that they think are necessary to protect their own health and that of their friends and their families. Personal responsibility and personal assessment of risk, not government mandates, are the way we are approaching this right now. People and businesses should review their existing plans and modify them as necessary depending on their specific circumstances. And I can tell you, by and large, most of the stores and most of the business I have seen in crossover have been doing exactly that. There really has been much change there. I'll bring you back a little bit of time under the former governor when somehow they decided to stop serving dinner after a certain hour because at 10:01 the COVID bug became a super bug. The fact of the matter was ridiculous. And at the time, the positive cases that were contact tracers were finding, I think it was 1.4% came out of restaurants and 70% came out of living room spread. So it was again, that was not something done that was logical or was it based in fact, science, or data. It was a reaction. We don't do that here. We are handling every crisis the way it should be handled in a methodical manner that makes perfectly good sense. The point here is that there is no one size fits all, and we in county recognize what we can and cannot do. And you know something, maybe I should add something to this. Maybe I should say it's more importantly what we should and should not do. What we can do is continue to provide access to and availability of vaccines and encourage those interested in being vaccinated to attend an upcoming clinic. You can make an appointment through our website. Again, that's rocklandgov.com, or simply walk in during any of the dates and times that are listed there. So if you have a crazy schedule like I do, and you know you may be free at some point during a day that they're dispensing the vaccines, then make a point of just walking in when you're free. I want to take a moment, however, to commend the staff of our Department of Health that has been regularly providing vaccinations since January, and for others who may not know this, a number of other employees of county government volunteered to go help the health department when things were really getting difficult for a bit of time. So their actions warranted so many emails and phone calls from people like you about how well you were treated, how well the process worked, and it deserves recognition. I want to just reiterate that again. The health department has issued over 50,000 vaccine doses. Our local health department has, and redistributed more than 14,000 doses to doctors' offices and pharmacies that lack storage capacity. You may remember that one of the things we did very early on, and at a great cost savings too, by the way, we ordered up a number of I think 4 refrigerators, John, if I recollect. 4 refrigerators because we were told very early that the vaccines needed to be refrigerated. We got ahead of the curve. Got refrigerators ordered up at the standard price, as you can well imagine. They went up quite quickly. Taxpayer dollars pays for that, so we spent your money wisely. And so we were actually using that component of equipment to help our doctor's offices, help our pharmacies who don't have that capability, and of course it's free of charge. We're not charging anybody for that. So we're doing the right thing for our local offices, whether it be doctor's offices or pharmacies. I want to thank you all for the work that you've done and continue to do for those who are immunocompromised and now receiving their 3rd doses. So Health Department, again, thank you very much for all your work. It's extremely important, and again, they've done an amazing job. I also want to reiterate again, as John mentioned, I am vaccinated. I will likely get a booster when that time comes. I urge you to consider it and talk to your doctor about it. Don't listen to just what's on social media or what your neighbors are talking about. I cannot tell you how many conversations I've had with people, and genuinely good conversations. There's nothing bad about these conversations, but the misinterpretation of things is just unbelievable. And the reason why is that there has not been a consistent message from the very top and all the levels in between. This is why we're, based upon the experiences I've had in emergency management and in talking to people who are involved in emergency management and county government, it is critically important to only offer facts. You can't, ad-lib too much to things and make false promises. Believability and trust are critical in times of crisis. That's what's important in order for everybody to work together and understand that we have a common goal. So I'm urging anybody who's thinking about this, get the good information you need. And again, as mentioned earlier, it's not going to be a panacea. This vaccine is not going to completely protect you. Not going to happen. It will afford you some protection. It will potentially minimize your symptoms from what we're seeing if you do get COVID. It'll minimize the time you're out of work or you're on downtime. So there are benefits to the vaccine, even if it is not 100%. So again, make your own judgments. I'm not going to here to sell you this right now, but talk to a medical professional and make judgments that decide what's best for you and for your family. If you have questions, you can call our health professionals here in Rockland County, our Department of Health. Okay.
Had a minor technical issue there with our with the stand for our tablets.
Are we on?
Yeah, we're still on.
Oh, we're still on. Okay.
I'm just going to hold it.
John does not have much faith in the clip right now. He's holding on to it. But anyway, you can call our health department at 845-238-1956, 238-1956, Monday through Friday, except holidays, from 8 a.m. to 5 p.m. You can also email them at the COVID call center at co.rockland.ny.us. John will put that up on the comment section so you have it. And speak to a professional. We have medical professionals who are in the health department. Speak to them. If you have concerns, if you have questions, make a good judgment based upon solid information. That's the best way to do this. And again, to reiterate, we're not here to preach, we're not here to order, and we're not here to mandate vaccinations. We will share the facts, the data, and the local experience that we see firsthand and report it to you unfiltered, so you can make informed decisions for you, your families, and for the community. And yes, what you do or do not do does affect others, so the decisions you make are a collective one, but not just the good of your own in your home, but the good of those around you. I hope that you all remain safe and dry. I think Ida is done, and the weather forecast right now is very good. So you can enjoy the upcoming Labor Day weekend. And I do want to mention just quickly, we have a lot of holidays on the calendar here in the United States of America, and Labor Day didn't magically happen. It happened because it was earned by blood and sweat of those past. We have a living wage in this country. We have safe working conditions. We have sick time. We have child labor laws in place. These are all things that were fought for, and many people were injured in that fight. It was fought for by those who passed us or before us in order to guarantee some of these protections that we take for granted right now. So, tip of the hat to our unions, our labor movement, and let us not forget those workers are the same ones who were out there during the pandemic, performed admirably during extremely difficult and scary times. Those people on the ground are your local labor, and those are the ones that I'm acknowledging today, and just as an added thought on Labor Day. So with that, have a great weekend, folks. We'll be back again real soon and give you another County Executives update. So until then, County Executive Ed Day signing off. Have a wonderful afternoon.